Yeah, good afternoon. My name is Hermann Einsele. I'm based in Würzburg. I am the director of the Department of Internal Medicine 2, where we treat a lot of myeloma patients, and we have a large program on CAR T cells and bispecific antibodies, so the new T cell-based therapies. Now, and we have learned that also T cells, like patients, sometimes get exhausted. And the question is, how much does this exhaustion play a role in the efficacy of these modern T cell-based therapies like bispecific antibodies and CAR T cells? And what we now know is that these T cells, when they are exhausted, they are less effective as CAR T cells, and they're less effective when stimulated by bispecific antibodies. So there is some concern and some strategies how we can prevent T cell exhaustion to make these T cells fitter and more effective. And I think that has been nicely shown with studies in which CAR T cells were given earlier. So for example, in CARTITUDE-6 or in KARMA, CAR T cells were given after a median of 6 lines of prior therapy. Now in CARTITUDE-4, T cells are given after 1, 2, or 3 lines of therapy, so much earlier. So the T cells were fitter. And we could already see in the results that these fitter T cells are more effective. So whereas in CARTITUDE-1, the overall response rate was about 87 to 90%, it went up to 99.4% in the CARTITUDE-4 trial. So doing T cell therapy earlier with less exhaustion makes T cells fitter. And we believe that the same is going to happen also with bispecific antibodies. And another strategy is to add on substances that improve the function of T cells. That is, for example, giving cell mods or IMS like pomalidomide, lenalidomide with a T cell engager or the CAR T cells to improve their function. So I think we are all fascinated about the fantastic results we have with the T cell engaging therapies like CAR T cells and bispecific antibodies. But T cell exhaustion is an issue, but we have strategies to improve it. And I think we can be very hopeful that in the future, these new treatments will become even more effective than they are today. So the question came up, why are T cells exhausted? So for example, if you have a typical viral infection which clears off after 7 days, T cells are active for 7 days without any problem. Now, if a tumor is in a patient and the tumor slowly grows, the T cells that are specific for the tumor cells have contact with the tumor cell for a long time period. And this long time exposure makes the T cells being exhausted.